Should popular weight loss drugs like Wegovy and Ozempic be used to help patients with psychiatric diagnoses lose weight? A recent news article in Reuters reported that psychiatrists and primary care doctors are increasingly using the class GLP-1 receptor agonists to help their patients lose weight, which is a significant issue in psychiatry because many of the commonly used psychoactive medications can trigger substantial weight gain. So patients and doctors are looking for ways to combat this. And in addition, many patients taking psychiatric medications encounter poor metabolic health and an increased risk for cardiovascular disease. So it makes sense that doctors would want to do everything they can to help their patients combat the adverse health consequences of psychiatric conditions and medications. But first, we need to ask if these medications like Ozempic and Wegovy and other GLP-1 receptor agonists, if they're safe in individuals with a psychiatric diagnosis. But first, before we get into that, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or medications. The problem is that the studies used to get FDA approval for the GLP-1 receptor agonists excluded anyone with a psychiatric diagnosis. So from a research and a scientific standpoint, it's unclear if the drugs are safe for this specific population. And there is a signal that for some, they may not be. As we reported in a previous video, European regulators are investigating up to 150 reports of patients developing suicidal thoughts while taking GLP-1 receptor agonists. And we know the medications come with other potential adverse effects, such as nausea and muscle loss, and now increasing reports of stomach paralysis. Yet at the same time, we've also seen an increasing number of reports of people using these medications and seeing not only weight loss, but actually improved symptoms of anxiety or depression. So it seems doctors are at a crossroads, right? They understandably want to help their patients. They have a drug that can help with weight gain, but there are some concerns about a potentially severe adverse reaction to the drug. But the way I see it, that's mostly a problem if there weren't other viable options, right? If the doctor had no other choices, then we could see their quandary. But the thing is, there's another very promising option, just not enough doctors know about it, at least not yet. And that option is ketogenic therapy. Numerous studies demonstrate the safety and efficacy of ketogenic therapies for helping not just with weight loss and improving metabolic health, but also a ketogenic diet or ketogenic therapies share some common mechanisms with the GLP-1 agonist drugs, only without the side effects and potential risks. And you can learn more about those in an interview I did with Harvard endocrinologist Dr. David Ludwig. But the bottom line is ketogenic therapy can be a powerful combination. One intervention that not only treats the side effects of the psychiatric medications, but can also potentially improve the underlying condition and potentially reduce the need for the medications in the first place. So I was fortunate to attend the International Society for Bipolar Disorder conference in Chicago in June of 2023. And deservedly so, there was a significant emphasis on the increased metabolic and cardiac risk observed in patients with mental illness. There was also a symposium where researchers presented 3 different studies demonstrating the safety and efficacy of ketogenic therapy for serious mental illness. Now, many psychiatrists in attendance were able to sort of connect the dots, right, and see how important ketogenic and metabolic therapies can be as a comprehensive therapy. But some were still hesitant and, worried about LDL or potential increased cardiac risk. Now, from our perspective, these concerns are unfounded and a misinterpretation of available science. And again, we did a prior video about cardiac risk from nutritional ketosis, which you can watch for further reference. But here's my question. Are those same doctors concerned about the side effects and increased suicidality and stomach paralysis and so forth from GLP-1 agonists? I hope so, as that appears to be an immediately pressing issue. But I have to admit, even as I say that, I have mixed feelings as well, especially seeing reports of people who've improved their psychiatric symptoms when taking these medications. And as I've said before, oftentimes medicine moves faster than the research, right? And so we need to do our best to figure out the best approach today, right now, for the patient in front of us. Even with the lack of research, how do we doctors figure out, what could be the best approach? So to help with this, we're going to embark on a series of interviews to better understand the pros and cons of GLP-1 receptor agonists in a psychiatric setting. As practicing psychiatrists and researchers, to get their input and see how they see it. We hope this exploration will help you have a more informed discussion with your healthcare team to see if these medications could play a role in your care, which should only be decided together with your healthcare team. But first, one theme I want to emphasize, and I'm sure will come up again and again, is that these medications are not a cure-all. And to use them in the absence of lifestyle changes is probably more harmful than helpful over the long run. So if they're used at all, they absolutely should be used as part of a comprehensive lifestyle treatment program. All right, so that's it for today's video. Thank you for watching. I'm Dr. Bret Scher, Director of Metabolic Mind, nonprofit initiative of Bazooki Group. And please keep an eye out for our follow-up videos that will delve deeper into this very important topic. And please leave us a comment about your experience with weight or metabolic health changes after starting psychiatric medications and what, if anything, has been helpful for addressing it. All right, thanks for watching. We'll see you here next time at Metabolic Mind.